Welcome everyone to the mental health portion of the presentation today. I'm Dr. Stephen Broughton, the National Chairman of Health and Wellness for Kappa Alpha Psi Fraternity Incorporated. And my esteemed guest today is my frat brother, Lorenzo Lewis, who is the CEO, the founder, and the creator of the Confess Project. I'm going to let Brother Lewis give you his particulars at this time because he has one of the most fascinating stories on mental health and how we as a community and as a people can arrest the stigma associated with mental health. Brother Lewis.
Yes, absolutely. Well, thanks again, Dr. Broughton, for this opportunity. I want to give a very huge gratitude to Black Health Matters and Kappa Alpha Psi Fraternity Incorporated, and also all of our guests that are here with us today. I think the greatest opportunity is that we get to share a space to talk about the health and well-being of us, and particularly African Americans right now in this moment. We're still in the residue of a pandemic in America on our health and well-being and a havoc of racial justice. And so I think that really brings me to why am I here, and the work that I've been able to do with the Confess Project has been truly about understanding the pain of purpose and resilience, but also understanding that story and how that story often looks very similar to a lot of other African American men that are, here in the United States and their families. So a little bit better about me. I always tell people my story started in a prison. My mother was incarcerated when I was born, and that's where my journey started. And I always say, being born in bondage in a way, one of America's probably one of the worst, institutes in the world is being in prison. So coming from that at the inception of my life, I understood that my back was against the wall, right? That my chances were very limited, that my success was very dim. And so, as life would matriculate, I would start to face a lot of other difficulties, and that was becoming part of street gangs and being diagnosed with major depression, being a part of a behavioral health system, being a patient in the behavioral health system due to trauma and depression. And so a lot of these things obviously did a lot to my own mental health and start to really, I think, inflict a lot of how I responded to personal relationships and how I responded in school, barely having a 1.9 GPA and being able to be, but I was grateful to be accepted to HBCU at University of Arkansas at Pine Bluff, who really gave me a chance to make it right. And so I used that story as a way to open up the floor, tell their story as a way. Storytelling really connects all of us at the Unisys. When we tell our story, it truly brings very beautiful things about. And I think that brings on what the Confess Project is about. The Confess Project is a national grassroots organization that focuses on mental health for young men of color and their families. But at the core of our work is training barbers across America to be mental health advocates. We also offer wraparound health services and mobilization support for these barbershops, connecting them with therapists. Today, we train over 400 barbers in 28 cities. And one thing that I didn't get to mention as a child, I grew up in my aunt's beauty salon. I went there every day as a kid, and we all know going to the beauty shop, going to the barbershop, that's probably one of the places we go to and we spend a lot of time. It shouldn't be wasted time, right? It shouldn't be time in front of the TV as much and talking about politics. But I was able to take a childhood memory and turn it into a reality of helping men understand their mental health, helping families get connected with resources. And this has been a fantastic thing. Today, we've again trained over 400 barbers and working with partners like Gillette and Toyota, and we've been able to canvas the country. So again, thank you, Dr. Brown, as you allowed me to open that up a little bit about myself, connecting that to our work. I'm excited to jump into this interview.
Well, I find it so fascinating because one of the things that the reasons I'm a practicing psychiatrist, as you know, and one of the reasons that I got into community mental health was because it reaches out more of our people. And one of the things, and when we met, you were just getting started on telling your story, but you got me to participate in a community organized event at a church in a school in North Little Rock, Arkansas, and it was exciting because to see our people come to talk about mental illness, which is such a stigma associated with mental illness. The number of people that we had there, the number of people that asked questions and wanted to know, is it all right to talk about this? Is it all right to seek help? And to see people of color actually providing that information and providing help, it was just it made my career in this field even more better for me personally. So I appreciate you getting involved and getting me involved in the community. Although I was doing community health, you know, I was basically seeing people who came to see me. Going out into the community, you reach so many more people. And going to the barbershop, man, we've all gone there. We talk about everything in the barbershop, everything.
Yeah.
So it was just one of the greatest concepts and ideas that I've ever been associated with. Tell me, in your going out and talking to people, what's the questions that people feel most comfortable talking about initially with?
Yeah, I think the one thing that we approach our barbershops in a very unique and organic way. Myself, I'm still a gentleman that don't mind putting on a pair of tennis shoes and a ball cap approaching these barbershops. So I think a lot of this is representation, right? It's people feel like they can relate. As we know, part of my ambition, Dr. Broughton, is for me to continue to become an esteemed professional and understanding that the industry involves me to be an expert in learning more about the trends. But I also realized that approaching these barbershops that I so much probably wouldn't do this best as going in there with a suit and tie, you know? And so that was something that we knew that this was an untraditional, innovative opportunity, but also still keeping in mind we're still in the community. We're still reaching people that honestly trauma has now allowed them to not see beyond themselves. These are folks that have not barely gotten out of high school, struggling in the generational wealth gap, bad health, seen community violence, and so we've had to approach it from a very unique and organic lens of using again that story that I opened up with. I've told that story because a part of our curriculum is we open that up with a story of resilience. And then we go into the other components about listening, how to reduce stigma, how to validate their clients. Like those are some of the other core areas. But a few questions to your question that we're asked is that, how do communities gain access when particularly looking at a majority field of white providers, right? Like what are some key things that they can do? How do they position themselves to deal with a system, right? That was also a greater part of the Tuskegee experiment, right? And how that trauma has now played into why they don't trust providers. And I think a lot of it, what we're doing is allowing barbershops and communities to know is that that this involves some restorative healing, and that we as a community, have to accept what's happened before us in order to move forward. And so those are just a few key things that we get into. But I think at the cornerstone is that I'm allowing them to know, hey, I'm an everyday brother like you. And I come from these same neighborhoods. I went to public school. I was also on reduced lunch, and so I've went through some of the same challenges. I've been incarcerated. I have tattoos. I've been in a gang. Like I get it, and so I think that has allowed us to build the power of the people in the barbershops, right? Because nowhere there they feel that this is an offense and or an ego exercise around my status, right? It's because so I think it's been received that way, and I think that's so the staff, the people that we've been able to hire, our organizers. I'm looking at those key ways of, do they fit, the population? Can they speak to the population of barbers? Can they speak to single mothers? Because we also involve children and families in our work. Right now, we're working on a grant opportunity in the state of Georgia that's going to allow us to evaluate our program, but really see how we can help women and children significantly get the services as well, because it's a unifying family approach. We're really helping build the Black family through the barbershop. Ultimately, we're helping alleviate poverty and we're helping increase access. So some of those are just kind of high level things, but I think that the premise is what you said is really what they say. Young people say it's keeping it real, keeping it straight, but also giving them valuable opportunities and educating them. I think in a way that speaks to them, in a language that speaks to them. And I think that's really key in moving the needle forward. So.
Well, one of the things that when we talked about it years ago, when we met at that church and that high school, one of the things before you even got started and taking it to grassroots and barbershops was the fact that you have to explain how we could get it to young Black men. And we were talking about it. I was talking about, well, how do we get this to young frat brothers on the college campus? Yep. We educated them, we talked to them, and they took it to the college campus, man. And I can tell you, because I work in a college town, as you know.
Yep.
When the word got out that you have somebody to talk to about your problems, about things that are stressing you, about the significance of talking about being depressed, talking about suicidal ideation and suicide prevention, those young brothers at that undergraduate chapter in Pine Bluff, University of Arkansas Pine Bluff, which we both attended, they went out into the schoolyard, and man, people really talked. And we got so many calls over at the mental health center. Just people wanted to see a therapist. They wanted to talk to people. They wanted to talk to somebody. They wanted to see if they were really depressed to the point where they needed medications. It was an enlightening conversation we had at that time. And although we're talking about your grassroots project, taking it to barbershops and going out to the Black community as a whole, it has worked on college campuses, and it can work further on college campuses. So the concept is in place, and it's wonderful. Now, one of the things you said that's important is the fact that they're seeing somebody who just looks like them. That's the most important thing in the world, because I came back to the state of Arkansas after training in psychiatry over 30 years ago. When I got in the state of Arkansas, there were 5 African-American Black psychiatrists in the whole state of Arkansas. 30 years later, there are only 8.
Wow. Yeah, that's
so we have to find a way to get our people this message that mental health is important, that Black health matters, and man, I'm just so proud of you and what you're doing. Would you tell people now some of the referral topics and tell them about how you teach these barbers and everything to refer to appropriate treatment?
Absolutely. Yeah, I think the one thing I did want to, there is an organization out of Charlotte, I believe it's called Why You Stressing. I think with an E is EU Stressing, but it's a gentleman out of Charlotte that offers actually an application to getting to build the field with more Black males becoming clinical therapists. So I know that there are those pipeline programs. We currently don't have that pipeline, but who knows what may come in the coming years. As you talk about access and opportunity, I know one thing we do offer is a lot of trauma-informed trainings and cultural trainings to therapists, organizations that are obviously are serving a lot of African American men and families. So these are activities we've done as well. We don't believe that our work is strictly about just educating and training barbers. That it's also about supporting frontline leaders.
Right.
Even all the way to law enforcement. I've been able to do that as well with them, because I think a lot of this is we've taken barbers as being that component of someone as the gatekeeper, but we're all gatekeepers in our communities. And if we look at healing from a framework of everyday people having the skills and tools, we really will be in a much better place. It's not taking anything away from our healthcare system. In fact, I think it adds value to our system, because people will have self-efficacy and the resilience to support each other, and they get to build a stronger toolbox. And I think that's what's really important, is that we as communities really help people understand their toolbox, right? Understand how music and how writing, and a lot of different, even our elders in our communities, how they are powerful to our health and well-being. And so I think is that's what we're teaching barbers. And so to get more into, well, what are we teaching these barbers? What does that look like? This is about a 60-minute training and discussion where it's four areas about, again, active listening, training them on how to actively listen, how to be able to understand keywords and messaging when working with their client in the chair. Validation, being able to validate their client, their emotions, being compassionate. Again, we're really unifying this thing around compassion and love in a way that allows people to validate. So when they're being listened to, they feel important. They feel anchored, and they feel precious in that moment. And people, when they often feel that way, Dr. Broughton, they often will respond better in most ways in their lifestyles, at work, with their families. We're also teaching them positive communication. So it's a four core framework on positive communication. How do you communicate with someone? Whether that's through greeting, hey, I'm checking on you today. Hey, how's things going? Communicating with that client. Hey, these people are coming to the chair. We've done the data to see there's over 100 people, current and existing clients, are coming to a barbershop. And just like you talk about college universities, we talk about fraternity members, school students. That's the same scenario. These people are coming to Greek events and gatherings over and over. And so when we are putting fraternity leaders in positions to be advocates, right? I think that's really powerful. Same thing we're doing with barbers. The last step of this concept is stigma reduction. How do we reduce stigma? Through language, also reducing stigma through narrative. And so that's more of um, you know someone making a response about, oh, it's I'm too strong to go and get help, and that barber being taught that, to diffuse that language, right? Like, hey, well, there are opportunities to get help, that it's okay to not be okay, right? And really having that conversation with that client about, how to lift that guard up. And I think we're teaching them things that they can do in an economical fashion. Still
Yes,
cutting hair is not
yes,
stopping business. It's a
yes.
phenomenal way. It's probably one of the most innovative ways that we're really going to get our country and the mental health system on a track where African Americans and minorities will get what they need, and really have their cup filled in a way that I think is going to be significant. So that's where I'm excited about that opportunity. We've been able to use that, and so hopefully that gives some context. But I'm super excited to continue this conversation.
No, I'm so happy, and I'm thrilled to death that we are addressing a much needed topic. You know, I give Grant Polmark, uh, brother Reuben Shelton III, Esquire, our Grant Polmark, credit for understanding that, you know, and he was so insightful, and he had a vision that occurred before this pandemic crisis, because he said, we got to, brother to brother, breaking barriers and building bridges. We have to be our brother's keeper. And this is what this is about, getting into our communities and working with the people that need this type of care is about being our brother's keeper. And during this pandemic, one of the things that we encourage people to do all the time was to reach out to brothers. Don't let them isolate themselves, and talk to each other, and touch each other, so that we can make it through this pandemic. And that has been one of the building blocks of making sure that we taking care of each other's needs, and going into the community. The test project is going into the community much deeper. Everybody might not be a fraternity in the fraternity, but everybody goes to the beauty salon or to the barbershop,
Yeah,
especially in the Black community. We do like to look good.
yeah,
Like I said, some of the conversations in there, I've learned as much in a barbershop about life that I probably anywhere in the world.
yeah,
So
yeah, yeah.
that's one of the best places to go to get the message out, for sure. Uh, how would you suggest, and this may be right in line with what you're doing in the community, but in terms of getting the message out to young Black males, uh, in college. It's basically the same way you put the information out the same way and talk about it. Because, like I said, the project that we started, the undergraduate college, was excellent. It's just a matter of continuing to do it and putting it out to other colleges. What would you recommend to the advisors in terms of how to get this started at the collegiate level?
Yeah, if I'm hearing you right, Dr. Brown, one way to engage, I believe engage advisors on the collegiate level about engaging with fraternity men, or again even with sororities and working with young women there on campus is I think this it starts with just a formal education around, and this may be done, I think, in a few unique ways. So I think one thing that I've saw that Gamma Sigma, shouts out to Gamma Sigma there at the University of Arkansas at Pine Bluff, Kappa Alpha Psi, but I've seen they've integrated mental health through their activities. They're through homecoming week, right? And so we got to be honest. People are not. I always say the one reason that we take mental health to the barbershop because people are not. Folks are still not at a place to just go and get help. So just telling somebody to go get some therapy is not the way to do it, right? We're very we understand that, and so I think finding unique ways to integrate this, whether that's through activities there on campus, that's to really involve the more of the student body. So whether that's through um, some type of event where there's some type of trivia, or maybe that's a few different ways to do that. I think always thinking about innovation and how we can engage innovation through health, mental health is always important, particularly with young people, particularly with marginal populations, because we also got to realize that technology is something that's very, very popular. It's something that's not going anywhere through social media. And so we have to understand that using our forces, our influencers, our culture assets, whether that's through barbershops, our culture components of popular organizations on campus to communicate this to our young people and to their peers. I think that's really where we started to win. And that'll look different at every campus based on the way that, groups and organizations formulate activities to the student body and their student union. I think that's one way. I think also looking at quarterly and even 6 month opportunities to do ongoing mental health symposiums and workshops. I think that we have to be honest that a one stop and done is not going to be it. We cannot expect to come on and do a mental health symposium, and then we never do it again. That is that we have to look at this as doing the same way we're going to do this Greek show every year. This has to be something to be integrated inside of our work on college campuses. If not, then we will pay for it somewhere, right? And I think we got to understand we will pay somewhere because the reality of it is, I think right now the CDC states that young black men under the ages of 20, suicide is the third leading cause of death. And I know with African American women, that number is high as well. Even with Congressman Bonnie Coleman, they've done extensive research on suicide with young children being a high. So we think about matriculating our young people into colleges and institutions. We have to look at a infrastructure of continually putting this messaging out and using our cultural assets. I want to keep going back to that because we have influencers utilizing, like I said, social media and technology. And even there's barbershops on college campuses, right? They're different. We think about our black college bands, and there's a lot of ways to go about doing this. Even through PSAs and marketing. I think that whereas people are now starting to really understand it more, I think now than they ever have, but we still have to understand we have a long way to go. And I think so. I hope to be an inspiration to others. Not only to say, "Hey, I am imperfect," because I've been diagnosed with depression, and I've also went through some of these issues of what a lot of young black men and what folks have, but I've also been able to overcome that, and I think that's important for that story to be heard
Very
because
important.
the reality of it is that everybody is not just doing well. You know, everybody is not just succeeding, and even what they may be doing on paper with their grades and their credit is good and they seem to have good. That don't mean they're happy inside. You know, so I think we always have to keep that at the forefront. I'm someone I worked in behavior health for a decade, Dr. Broughton, just as a mental health tech and working with the population, and I can tell you that we are in a serious business about being aggressive about how we approach communities, because if we don't, again, I just think it's going to be continue to be a ripple effect, and it may not be at our best desire to see how they will turn out. And so, if we're about serving our community, I think we got to always stay at the forefront of doing this. And like I said, we've been doing this work even before it was popular. You know, as you know, years ago,
Yeah,
nobody wanted to talk about, black men and being in a barbershop and talking about mental health. We did it when it wasn't popular. We did it when nobody, so do it even when it's not being talked about, because it's a commitment. Just like we say, it's a commitment to our health. It's a commitment to doing this. Anything else in our life. So
we've had a couple of questions to come in, and you've answered part of one, and I'm going to give an opinion a little bit about it. One question said, how do you suggest younger generations to go about talking to their parents about their mental health struggles, especially in the Black community? Now, one of the things you talked about was, you talked about technology and social media and everything, but I've talked about just something old school. People need to have dinner at the table
yeah,
again.
yeah, yeah,
You
yeah,
know,
yeah,
I talked to my kids when they were home at the table.
yeah,
We talked about everything that was important to us at the time and important to them at the time, because they needed some place to express themselves. And that's the most common time in a household that people get together, is at the dinner table.
yeah.
Now, I know that people have busy schedules and everything, and do various other things, but you need to come together as a family at least one time a day to talk about whatever you need to talk about. And that includes your mental and physical well-being. Now, another question that came up in was about technology is great for young salons. For those who can get their hair done, how about local events outside of church that many people don't attend anymore? Where do we go find these people?
Yeah, mom. Yeah, that's a really good question from Vital. I think the one way to look at that is, you're right. A lot of folks are not, young people are not able to, they may not, again, going to church. This, I think they say this generation is not much in church as there's ever been, particularly when we think about, the pandemic and how that's taken a shaped effect. I would like to say again, I think looking at this through an opportunity of community. I know that I've seen. I work with a young lady in Boston that does parades, just actually community parades inside of the community in Boston and the Dudley community, and I know that like a part of that is that they're bringing out screenings, people to do screenings and to do different things. Now I would have never imagined with a community parade, being that it's so kind of around celebrating community and the arts and all of those different things, and how you can really integrate that in there. And I think that's one way. I also think, as you said, Dr. Broughton, going back to this, is that I think we have to have a real conversation about peer support.
Yeah.
Um, what does peer support look like besides family? I know one thing we always encourage our barbers is that when being an advocate is really being a ripple effect and powerful, because
Right.
it's not just about going to see a doctor or going to see a therapist. Sometimes it's instilling those skills and tools within the people around you, even yourself, so that your community can also be a part of your journey with you.
All right.
And so,
They've given me the clock, so they
okay.
want you to give a summary statement, and I'll follow, and we'll shut it down, and we'll allow people to come into your booth, talk to you at your point in time. Okay.
Yes, absolutely. Again, thank you all for the opportunity. If you want to learn more about the Confess Project, please be sure to reach out to us at www.theconfessproject.com. You can find out about our work. Super excited. Thank y'all for the opportunity. Thank you, Dr. Brown.
And we have community mental health centers in all states, but uh, the first place you can go is your primary care doctor. And if you tell your primary care doctor that you have some depression or anything, they will make a referral to you to any mental health center or any psychiatrist or psychologist that does mental health counseling. So there's always places to go. I also believe strongly in pastoral counseling for those that attend church and have a pastor that they believe in. Pastoral counseling is very good, uh, especially when you have well-informed pastors who also believe in the science of medicine as well as, as their own works. So with that being said, we thank everybody for coming on, and we have a booth set up where you can get in and ask further questions in our virtual booths. Thank you so much for this opportunity to present you today. And Brother Lewis, thank you for providing your vision and a source that people can also relate to at this time. Thank you very much, everybody.
Absolutely. Thank you.